Okay, so Jason Buckner, I'm the CIO at MedEx's, and we are a health information exchange. We are based in California. We only do business in California. Um, we are a very large HIE. We have 32 million patient records in our master patient index. 71% of those have clinical data. I think the key for us here is that we truly do sit in the middle of various constituents. So we have a large section of hospitals that connect to us, around a dozen health plans as well, and then inching up on around 2,000 total healthcare organizations, including thousands of ambulatory practices. Most of all of these organizations submit data to us for their respective sites. As you can see here, we're high trust certified, and we are validated under the data aggregator validation program for NCQA. So our program history under the DAV program is that we were part of the early adopter group in 2020. We went through the full certification process last year in the July cohort, and we are going to do that again this year. So we're getting ready. The clock is ticking. We're about to start the process yet again for this next year. A little bit about 20 and 2021 on some stats on how well we did. Not so great in 2020, as you can see here. We passed 12% of our cases the first year, and a huge jump in 2021 to up to 83%. From a cluster perspective, you can see those rates over there as well. We only passed 3 out of our 10 clusters in that early adopter program, and a much higher rate in 2021. That is mostly due to us getting a lot smarter about who we selected to submit into the program for DAV. A little bit more about, from the health plan sort of perspective, how much of your data is certified. Initially, when we were thinking about this program and the early adopter, we had this utopia approach of, well, we'll just certify everybody in our network. And we quickly learned that that was probably a really, really bad idea. And so in 2020, we certified about 6% of our entire network of data. Very small percentage. Health plans were happy that we were DAV certified, but the value to them, with only 6% of our network being validated under the program, wasn't so great. And so last year we increased that to 47%. We want to increase that even further. The health plan impact on the right is the real key here, though. We had around 12 million visits for our health plan members, and 9 million of those were at a DAV certified site, so 73%. And so what that shows you is we targeted sites where there was a high volume of visits by health plan members. And that was really a huge change that we took from 2020 to 2021. So it's sort of like a wrap up of like, what are the key sort of like learnings that we had that I want you to walk away with between 20 and 2021, and what we're going to continue to evolve for here in this next cohort in 2022. Select your targets carefully. So for the folks that you want to involve in the program, we use, I think, a 5-point scale of an analysis. The most important are these 3 factors. So the first one is we poll our health plans and we say, we know you want DAV data. What are your highest value targets, right? Who are the folks that you really, really need that standard supplemental data for? We get that list from them, and that informs us. The second is we do a pre-analysis of data content and quality, and that is a really critical step. We monitor data quality and content upon implementation. We monitor it ongoing, but we don't always monitor with sort of an eye towards details specific to HEDIS or details specific to PSV. And so doing that analysis beforehand is critical. And the third is this subjective, what we call our participant cooperation level. We have very happy paying customers, but some of them do not want to make time to do a chart audit with us. No matter what we want from them, they just do not want to spend the time and energy on that. So understanding your relationship with your practices and your hospitals is really key. The second main takeaway I would say is resource this appropriately. If you're going to go to the DAV program, it is not a small lift, and it requires a quite, in my opinion, a diverse set of stakeholders from health information exchange to do this. You'll need technical folks to do this. You'll need customer success or account management type of folks. And then you'll need the operations team to understand all the documentation of the processes. The last sort of pillar is health plan readiness. So understanding and learning if a health plan wants DAV data and can accept that is a very long cycle. So it is not a simple, do you want DAV data, and you get a yes. There are lots of diverse teams. There's often multiple sets of software at a health plan that you have to work with to understand, can they take the data in, and if so, what format and such. So ask early. To the polling question that we got, be prepared to have variance in formats that plans want. So we have, I think, 6 plans that are interested right now in DAV, and we have a net of 5 different formats that those plans want. So it is definitely not a one-size-fits-all. It is CCDA and flat file for us, various flat files. The other is to just be cognizant of the timing, right? So this bumps up against the holidays for our cohort. Plans want to know today who is going to be certified. Unfortunately, we can't tell them until the DAV certification program is over. And so because they have their HEDIS season in the first quarter. And then the last piece is for plans that are receiving data today that we would classify sort of as non-DAV data, existing feeds to help inform HEDIS non-standard data. When you provide DAV data, that means you may be providing the same data twice. So there may be DAV data and non-DAV data feeds, and various plans will want that data delineated and slice and dice. So that is an additional lift and consideration for both the plans to understand how they want their DAV data versus non-DAV data, as well as the aggregators providing that data.